Haven for Hope is a unique and hybrid model for service to those without an ongoing shelter in San Antonio. This service is not made possible by one person, or one organization, or even one method, but by the commitment of many, all forming arrays of care toward housing and wellness. At the center of Haven's service is the person or the family, and the focus is on recovery, to holistically improve their health and to live a sustainable, meaningful life in a community of their choice. Services provided on campus are guided by these principles: that recovery is driven by the person, is holistic, and supported by peers and relationships. Care that is trauma-informed, all strengthening the individual, the family, the community, along with responsibility, where respect and hope can emerge in their ongoing and future life journeys. We meet them where they are, for who they are, for their potential, for their purpose in this world, for their human worth. Every person and family who comes to the campus is in need of shelter, food, health, healing, and support. People come to Haven for hope and new beginnings. Each person or family is welcomed in through a triage process at intake, where their life journeys are initially heard, and then to the best of our abilities, they are pointed to the best fitted resources available to meet their needs. Sometimes that means the resources at Haven. Sometimes the best fit will be off-site. Shelters, food pantries, substance abuse treatment centers, veteran support systems, transportation, supportive housing, and counseling centers. On-site at Haven, there are several programs and possibilities available as well. Sometimes the best fit is to point people to the safe overnight sleeping on campus, called Prospects Courtyard. It's a place where guests can receive 3 meals a day, showers, laundry facilities, spiritual care, and some basic community resourcing, and for some guests, an eventual move onto the main part of campus. This is especially true for those who reside on-site and are ready to commit to making a significant change in their life. Residents are connected to their own case manager and into a recovery process of their own planning and choosing. Their plan begins with an orientation to Haven and personalized planning. With coaching by their case manager, a plan develops along with assessments and connections to resources to give their plan's best potential. Implementation begins within the first 30 days, along with peer and community support, spiritual care and connections, and education and vocational development. Along the way, adjustments to their personalized plan are made hand in hand with their case manager, all leading toward plan completion, graduation from Haven, a self-sustaining life, and reintegration into society. Aftercare is provided for a year's time to help support their new beginning. Many, if not most of those who come to the gates of Haven are in need of health care. The Healthcare Center and the Restoration Center both provide such services and are open to the public as well, providing screenings, immunizations, basic medical care, eyeglasses, dental repair and hygiene, detoxification, and more. Likewise, some folks enter the Haven campus with mental health concerns. There's a program for those needs in the in-house wellness program, stabilization of environment and medications, counseling and interventive care, spiritual support, classes, and a sense of community. Although these resources are what make up the in-house wellness program, similar resources are also accessible throughout campus in other programs. Some who come to Haven suffer from substance abuse and addictions, and there's an in-house recovery program to meet their needs. This approximately 90-day program includes the 12 steps to recovery, peer and group support, spiritual wellness classes, vocational development, housing placements, and for some, movement into their own personalized life journey plans after completion of this program. This Haven model of hope and all these arrays of direct care and systems are made possible by the working together of community resources and partnerships both on-site and off-site. One large and very committed array of care involving nearly 100 organizations and agencies. Movement on-site is interactive between resources, all striving towards self-direction, individualized planning, empowerment of the whole person, based on a person's strengths and potential within a support system that nurtures trust, respect, mutual responsibility, and most importantly, hope. All the arrays found at Haven, from the array of wellness to the array of community resources and partnerships, to the arrays of direct care and systems, for those most in need in San Antonio and Bexar County. We are Haven for Hope, a place of hope and new beginnings.